Hi, I'm Dr. Liz Cruz, gastroenterologist here in Phoenix, Arizona. Thank you so much for watching this. Today, we've got a very exciting topic. We're going to jump right into our Disrupting the Medical Industry series. And if you missed our first video, go back and watch it when you get a minute, where we talk about this series that we're going to be doing and took you even on a little shopping spree. Great video. So check it out. Let's go ahead and jump right in. As you can see, you've got a bunch of medicines here that, for the most part, there may be some of you who recognize these names right off the top of your head. These are for heartburn, acid reflux, gas, bloating. I just want to walk you through what we have sitting here. Again, you can buy these over the counter. That's exactly what we did, and we showed you that on the first video. Right here, we've got Mylanta, Rolaids, and we've got a couple different versions of Tums. These medicines are probably some of the most common medicines that people will take when they start having heartburn, acid reflux. You can buy them anywhere, even at a local gas station. What these medicines do, they have ingredients that help to calm the acid down by neutralizing it. So basically just calming that acid down. This one has the added ingredient of simethicone, which actually helps with gas and bloating. These are medicines that people will take that gives very temporary relief because all it's doing is neutralizing or calming down that acid to just help them right at the moment that they take it. These medicines, Zantac, Pepcid, this is the same one. The generic name for this is famotidine. Very common also. These are called H2 blockers. And these basically block acid through one channel in the stomach. It blocks the acid, so it is a little bit stronger than these, gives you a little bit more relief than this, which is more of a temporary fix right at the second that you're taking these medicines. Very common. These have been out for decades. And again, like I said, they basically are just blocking acid through one of the channels. Then we move into these medicines, which are stronger medicines. These are called the PPIs, or proton pump inhibitors. Very common. You may be familiar with Prilosec, which is the same as omeprazole. This is Nexium. This is Prevacid. These are all in the same class of medicines called PPIs, which block acid through 3 different channels. So super potent. These are your more super potent acid reflux medicines compared to these other medicines. People buy these over the counter. The problem is that these are just temporary, that give temporary relief. They're just quick fixes. These are not long-lasting relief. People will go and buy these because you can buy them over the counter and they'll take them over and over without actually going to get worked up. Let's just go back again to what these are doing to your stomach. These are neutralizing the acid. These are literally cutting down on the acid that you're making, which is a problem. It's a problem because you actually need acid to help you digest your food that you're eating, especially protein. The acid that your stomach makes actually has a purpose, and it has more than one purpose, one of them being helping with digestion. So when you are taking these medicines, yes, they may be helping you with heartburn and acid reflux, but now they are hurting you because now you're not able to digest the food that you're eating. So you may not be getting the nutrients from that food, not to mention that by just taking these ongoing for months and even years, especially years, there's a lot of potential side effects that you can have from this. So you've got the issue of people that are self-diagnosing themselves, going to buy these. And mind you, typically you can only get a 1 week or 2 week supply of these. And the box will say, warning, you should not take these for more than 2 weeks. Well, the reason for that is because they don't want you self-diagnosing yourself. And if you are just taking these ongoing, you could be missing a really serious diagnosis, which is why it's so important to still go and get worked up by gastroenterologists if you're having these symptoms so that you can get tested and make sure that there's not something serious going on. But the other thing with taking these on an ongoing basis is the side effects that can be caused from these medicines by the mere fact that you're blocking the acid. And part of that is that you're not getting the nutrients that you need because you're not digesting the food well. So you're missing out on a lot of nutrients. Another thing is that by blocking acid, it also makes it very difficult for your digestive system to absorb certain minerals that you need. For example, you have the whole issue with bone loss, like bone density, you osteoporosis, osteopenia. This is a very good example of something that could develop down the road when you're taking these medicines ongoing for years because you are not being able to absorb certain minerals. Even iron deficiency anemia could be caused by someone that's been taking these medicines ongoing for years. So it is concerning that you are not going to digest your food well, that you're not going to get the nutrients, that you could develop issues because you're not getting certain minerals, certain nutrients, even people having muscle spasms because maybe they're not getting the magnesium that they need. So it's not just a simple thing and just one thing that can occur. Look, these medicines have their place, okay? There are times when I have to use these medicines if I find an ulcer in someone's stomach, or if I find an infection like an H. pylori infection. I've got to treat that person with antibiotics and with one of these PPIs. So there's definitely a place for these medicines. But if you're someone who's just going to the local convenience store and just buying these and just taking them over and over, and you haven't gotten worked up to make sure that there's nothing bad, you need to go and do that. And the ultimate goal for me is to try to get people off of these medicines. I want to try to get them off of these medicines. So you may be asking, okay, well, how do we do that, Dr. Cruz? Well, one of the ways in which I've been able to help my patients and clients get off of some of these medicines is by getting them started on digestive enzymes. This is the Dr. Liz Cruz Everyday Enzymes. This is a capsule that's full of enzymes that are going to help break down proteins, carbohydrates, fats, and even salad, plant foods. This is going to help to break down that food. These, you take them when you eat. It breaks down, the enzymes get released out of the capsule, and those enzymes help to break down the food so that you're actually getting the benefit, the nutritional benefit from that food. In addition to that, these enzymes have helped so many of our clients with their heartburn and their acid reflux, where they've been able to come off of these medicines because now they are getting relief of their symptoms with these enzymes. Not only that, now because their food is getting digested, they're getting the nutrients from that food. And also, it helps a lot of our patients or clients that have gas and bloating. This is something that has helped so many of our patients and our clients, the everyday enzymes. Remember that I told you that my goal is to get my patients, to get our clients off of these medicines. Well, there are certain situations where I do have to have someone on a PPI ongoing. Specifically, one of the things I'm thinking of are my patients who have Barrett's esophagus. Those patients are patients that I typically have to keep on a PPI to help prevent the progression of the Barrett's. Those patients in particular are the people that for sure I need to get on these enzymes because this is what's going to help them. They have to take this PPI. This is going to block the acid to help protect the Barrett's. But in addition, now they're not going to digest as well. So I always try to make sure I get those people on the digestive enzymes so that this can help break down the food when they eat and so that they can get the nutrients that they need from the food that they're eating. And in addition, by taking these enzymes, they can also slow down the side effects that will eventually come into play down the road after years of taking a PPI. If you want to get these enzymes, if you're someone who suffers with heartburn, acid reflux, gas, bloating, if you've got Barrett's, please get these enzymes and get started on them right away. There's a link I've included on this video. You can click that and get your enzymes today. Thank you so much for watching.